Hello, everyone. We still have people joining, so welcome. We will begin. Please, as indicated in the chat, you can rename yourself so we know where you're coming from with your name and your organization and country. It will be very helpful to know where all of you are coming from in the region and from outside the region as well. And also to let you know that in this session, we will be having interpretation in French, a simultaneous interpretation, French and English. You have a globe below. So as our colleagues are joining, I would like to welcome you and begin with some logistics and housekeeping. We are recording this session, and you will also be receiving a copy of all the presentations and the materials and links that will be shared during this webinar. We encourage all the speakers and panelists to turn on their videos so that we can see you as you speak. In terms of interpretation, I already mentioned there's a little globe that we would like you to click on, and you choose your preferred language. And can you share the slides, please? You turn up the slides. Sorry. And also, we have a Q&A box that you can, throughout the webinar, you can indicate your questions and we will respond as we go. And if you do have some technical issues, we'd rather have you put in your request for assistance in the chat box, and we will be with the colleagues, we will be going through this, and you'll be and respond to your queries. So once again, a very, very warm welcome. We're almost 100 online and hoping that others will be joining very soon as well. So this is really a warm welcome on behalf of the organizers, SSATP, that's the Africa Transport Policy Program, the George Institute for Global Health, UNICEF, and WHO. We're delighted to have you all with us today. My name is Binta Sako. I work for WHO Regional Office for Africa, and I'll be your moderator for this 1.5 session where we will be presenting to you two main reports around road safety in the region. One is the Africa Status Report on Road Safety, which has a continental view of road safety, and also Protecting Young Lives, which is a report from UNICEF around the road safety of children and adolescents. We will have the webinar will be in three different times. First, different parts, sorry. First, we will be presenting these findings of the two reports. Then we will have a discussion with experts on key issues revolving around the findings of the report. And finally, we'll have a session, a Q&A session, where we will have your questions answered by these key experts, and hopefully we will be able to have, as much as possible, an interactive session before we close. So really looking forward to these discussions, and as already mentioned, please do put in your question as they come into the Q&A box. Now, without further ado, and to kick off this discussion, I'd like to invite Mr. Mustafa Ben Mamar, the SSATP manager, to welcome us to this webinar today. Over to you, Mustafa.
Thank you, Benta. Welcome everyone, and thank you for joining today's webinar. As Benta in her introduction, we're gonna discuss two interesting reports. The first one is the Protecting Young Lives, the Global Status Report on Child and Adolescent Road Safety, prepared by the Georgia Institute for Global Health. And the second one is the Africa Road Safety Status Report for the year 2019. 2025, prepared by WHO and the SSATP. As you know, I think from these two reports, I think the main finding is that the road traffic crashes are the leading cause of death among children and adolescents aged 5 to 19, that's worldwide, with over 90% of these fatalities occurring in low and middle income countries, which is well aligned with the finding of the 2025 Africa Road Safety Report, which highlights that the Africa bears a disproportionate share of these losses, particularly among vulnerable road users such as pedestrians, cyclists, and motorcyclists. Children walking to school and young motorcycles are among the most affected. These two groups are also priority focus areas under our SSATP fourth development plan. So addressing their safety is a complex, multidisciplinary challenge, one that demands different skill sets, perspectives, and teamwork. That's why I am glad we are having this discussion today together with our technical partners, the WHO, UNICEF, and the George Institute for Global Health. Both reports provide good insights to road crashes, and I hope you will also be able to discuss the feasibility of the policy recommendation for the prevention of road traffic crashes in children and adolescents. A final point, as SSATP, we work on two streams. The first one is to produce some knowledge product and papers, and the second is really capacity building. For the road safety pillar, we have a 5-day road safety training management training program we developed a year ago in both languages, English and French. And in the discussion, and maybe later on, I think it will be good to discuss the opportunity to include these reports on children and adolescent safety as one of the modules of the training program, because it's good to have all these knowledge products, but I think we will not reach our objective without disseminating them properly and bring them to the main beneficiary. And we thought through this capacity building program, it would be a good way to do that. So this is just a short remark to introduce, to welcome you all, and I wish you a good webinar. Thank you.
Thank you very much, Mustafa, for setting the scene and for already thinking forward on how we can implement and we can make changes using the recommendations from these two reports. So I would like to now begin with the first part of our webinar, which is the presentation of the two reports. I will first begin by inviting Dr. Prasanthi Atwood. She is a senior research associate at the George Institute for Global Health, Imperial College London, with over 20 years of expertise in injury prevention. She has provided strategic guidance and technical support for projects like the Bloomberg Global Road Safety Program, the Butner Child Road Safety Challenge, and multiple other initiatives working globally and also in Africa. Dr. Atwood will now present on Protecting Young Lives, Global Status Report on Child and Adolescent Road Safety. Welcome, Prasanthi, and over to you.
Thank you very much. Good afternoon, everybody, and thank you for the opportunity to contribute to this really timely and quite vital conversation. I'm honoured to be presenting this work on behalf of my colleagues, Dr. Margie Peden, who I'm sure many of you know, and Dennis Mazingi, who were the main authors of this report, but unfortunately couldn't be here to speak today. The report I'll speak to, Protecting Young Lives, it's the first global synthesis which is focused exclusively on the road safety of children and adolescents. Produced by the George Institute in partnership with UNICEF, it not only illuminates that scale and urgency of the issue, but it's also a strategic tool for action. It's grounded in data, policy analysis, and an unequivocal call for investment. I'll begin with the broader context and the rationale which was underpinning this report. I'll then summarize some of the key epidemiological and policy findings with a particular emphasis on regional trends and high-risk geographies. And then the final portion focuses on the report's utility, how it can be used to drive more child-responsive policymaking, smarter investment strategies. We've tailored this presentation to resonate with the broad sort of global perspective. And I know that Maricela will be focusing after this on the African region and the region-specific road safety report. So I don't need to preach to the converted. Road traffic injuries are not simply one of the many health threats to children and adolescents. They are tragically the leading cause of mortality amongst those aged 5 to 19 worldwide. And this is a profound public health failure, one that is both preventable, deeply inequitable. And yet these children and adolescents remain peripheral in most of the national road safety strategies. Their risks are qualitatively different from those of adults. They're more likely to be pedestrians, they're more likely to be travelling during school hours, and there's a lack of access to protective infrastructure. Then compounding this is that the paucity of age and mode disaggregated data, which renders the scale of this issue largely invisible to policymakers and to planners. And this report seeks to correct that particular blind spot. So Protecting Young Lives addresses that crucial and persistent gap, that structural invisibility that I mentioned of children and adolescents in the global and in the national road safety discourse. Too often, that unique risk profile of this particular demographic, which is shaped by their developmental stage, their mobility patterns, and the limited agency that these children and adolescents have, it's not reflected in policy or program design. Moreover, our review of the legal and the regulatory frameworks reveals striking inconsistencies. So whilst many countries now have adopted broad traffic laws, far fewer have actually enacted or enforced measures which are tailored specifically to children's safety. And these emissions are not merely a technical oversight, but they are having a real measurable consequence for our most vulnerable populations. So this slide illustrates just how road traffic injury risk shifts markedly across that childhood and adolescent life course. A younger child is more at risk as a pedestrian or a passenger, often dependent on adults to make the decisions for them and to protect them. Whereas an adolescent may face risk as an emerging road user, perhaps they're a motorcyclist or a cyclist, or even sometimes a driver. And understanding these age surfaces is really critical. It reminds us that a single intervention, say a helmet law or a seatbelt law, will not be sufficient across this age spectrum. So we need interventions to be sequenced, to be layered, and to be calibrated to both the developmental and the contextual realities of young people. And in the African context, where these transitions to independent road use often happen much earlier and in riskier environments, this age-sensitive framing is especially salient. This kind of slide will be familiar to a lot of you. It represents a striking age disaggregated view of the leading causes of death amongst children and adolescents globally. And it's drawn from WHO and IHME data. What's most striking here is the emergence of road injury as the leading cause of death from the age of 10 and its persistence through adolescence. By the ages of 10 to 14 and 15 to 19, it's overtaken infectious diseases, congenital diseases, and even COVID-19. It is quite literally the most likely way that a young person will die once they reach secondary school age. So this report, it's grounded in the most robust global data sets available, including WHO's global health estimates and IHME's global burden of disease data. But it goes beyond just describing mortality trends. It also maps existing national laws and policies, assesses their alignment with international best practice, and crucially, it examines whether those policies are actually attuned to the specific needs of children and adolescents. So in this sense, it's a bit of a hybrid tool. It's both a statistical compendium, but it's also a strategic diagnostic for countries who are seeking to align their child road safety efforts with a much broader public health, education, and urban mobility agenda. So what did we find? Well, the global risk landscape is shifting and it's not in our favor. So by 2030, over 2 billion vehicles will be on the world's roads, with 60% of the population residing in urban areas. Yet already 500 children and adolescents are dying every day in road crashes, amounting to one death every 3 minutes. So more than 90% of these deaths are occurring in low and middle income countries, often in settings where transport systems have not kept pace with demographic or with infrastructural changes. And this is not a marginal issue, it's a central concern for sustainable development or urban equity, or even just intergenerational justice. This table here starkly illustrates the disproportionate burden of road traffic deaths amongst children and adolescents across the income levels. In 2021, when this data was from, nearly half of all deaths occurred in lower middle income countries, and a further quarter were in low income countries. And this is despite the lower motorization levels, which highlights just how deeply these outcomes are driven by structural inequity, by the absence of safe infrastructure, by weak enforcement, by a lack of access to emergency care. Most striking is also the contrast in the mortality rates. Children in low-income countries face a road traffic injury death of 14.3 per 100,000, which is more than 5 times that of children in high-income countries. These are avoidable deaths, and the disparities reflect a lack of global and national prioritization of road safety as a child health or as a developmental issue. This second figure disaggregates deaths by road user type across UNICEF regions. In both Eastern and Southern Africa and West and Central Africa, pedestrian deaths, as you can see, dominate. And these patterns are strongly linked to the built environment, where children are often walking to school alongside high-speed traffic, without pavements, without crossings or protected zones. We also see a higher proportion of motorcyclist and motor vehicle deaths, particularly in Latin America and parts of Asia, indicating a need for age-specific protective legislation, particularly around, say, helmet use or child restraints and enforcement. But I think what's essential here is not just recognizing who is dying, but using this disaggregation to tailor the interventions. A one-size-fits-all approach is simply not going to work when the risk profile of, say, for example, your 10-year-old pedestrian in Nairobi differs so profoundly from that of a teenage motorcyclist in Manila, for example. So this third figure brings all of these insights together by showing the road traffic fatalities per 100,000 children and adolescents, stratified by both the region and the income level. It reveals just how entrenched that burden is in sub-Saharan Africa. In West and Central Africa, you can see that the fatality rates amongst children approach 40 per 100,000, which is more than 6 times the global average. The Eastern and Southern Africa are also showing persistently high rates across all of the income tiers. So this points to the intersection of the rapid urbanization that's happening, informal transport mechanisms, but also the under-resourced governance surrounding road safety. Even in middle income settings, the protective effects seen in other regions are much less pronounced. So it's here that the need for investment is the greatest, and where the data from this report can really serve as a lever for coordinated policy reform and for financing decisions. So what's in the report? Well, to support the efforts, the report is structured around 4 key components. First, it makes the case for a child-focused approach, why road safety must be integrated into national child health and developmental agendas. Secondly, it presents the most recent and the most robust estimates of the global burden of road traffic injuries. Third, it outlines a suite of evidence-based policy options that countries can adapt to their context, from legislative reform to safer infrastructure to community-based interventions. And then finally, it enables us to provide a clearer picture of the current status of policy and practice, where countries are performing well, but also importantly, where significant gaps remain and need to be addressed. So it's important to highlight that this report is not simply a repository of data. It's a practical designed tool to support advocacy, to support policy making, and to support resource allocation. It's meant to help governments and partners to benchmark national performance, identify the gaps in their legislation, and assess, importantly, their alignment with international standards. It allows users to prioritize interventions based on local burden and local capacity, ensuring that those resources are actually directed where they will have the greatest impact. So by offering a baseline of policy and outcome indicators, this report provides that foundation for monitoring that progress over time. I've taken one example here from a separate region, from Indonesia, where policymakers and advocates have actually used the report's legislative maps to highlight the lack of helmet laws protecting children. This evidence from the report was translated into a whole host of visual advocacy materials that reached both the public and the political decision makers. And as a result, discussions on reform gained traction, and now a new protective legislation has been put forward. So this demonstrates the power of data when it's made accessible and when it's mobilized through the right channels. And in the African context, similar approaches can be used to support school zone safety campaigns, to advocate for child passenger regulations, or push for safer public transport systems. So to conclude, this report is not simply a catalogue of risk. It's a tool for transformation. It offers governments, donors, and advocates the evidence that they need to take targeted, age-specific action to prevent our most vulnerable children and adolescents on the roads. The data is clear. Road traffic injuries are the leading killer of young people globally, disproportionately so in low and middle income countries. But we also have clear solutions. We know what works: safe school zones, speed management, helmets, child restraint laws. all tailored for children. An investment in walking infrastructure and safe transport options. So what's missing is not the evidence, it's the implementation, it's the financing and the political prioritization of all of this. And this report equips us to move from tragedy to accountability, from reactive policy to anticipatory design, from fragmented initiatives to much more coordinated, multi-sectoral responses. And most importantly, from this report's perspective, from silence to visibility for the world's youngest and most vulnerable road users. As we as a community look ahead to 2030, let's make child and adolescent road safety not just an afterthought, but a central measure of whether our systems are fit for purpose, whether they serve not just movement, but equity, health, and the right to grow up safely. I thank you.
Thank you very much, Prasanthi, for this very clear presentation. The facts and figures are really disturbing, especially knowing that until now, this has been an almost invisible issue. This report, as you said, it's more than a report. It's a toolkit that takes us from data to action. And I'm sure we'll be able to delve more into it with the discussions. And once again, I invite all the participants to put in their questions in the Q&A, but also to share experiences on how they have made roads more secure, more safe for children and adolescents. Now I would like to turn to Maricela. Maricela Ponce de Leon Valdez is a senior transport specialist working at the SSATP, and she comes from she has a wealth of experience from Latin America, Asia, and she's bringing that expertise, enthusiasm as well to the African region. So I will hand over to you, Maricela, as you present the findings of the Africa Status Report on road safety. Over to you, Maricela.
Thank you, Binta. I just want to confirm you can see the screen, right? Yes. Okay. Thank you. So yes, so now we're gonna go from, I think we heard a lot of very insightful information regarding these most vulnerable users. And now we're just gonna go and have a quick look at what this looks like somehow in Africa. So just a quickly overview of this Africa Status Report on Road Safety. 2025, as Mustafa mentioned, this has been a collaborative regional approach between some of our main partners, including WHO and the African Union. The main kind of objectives is really to give a snapshot of the current situation to decision makers, to practitioners, and kind of to also support the global efforts into giving somehow a monitoring tool that countries can use and the region as such can use as to monitor the efforts and also show some gaps and propose actions. Now, when we look at, and sorry, one important thing to mention about this report is that it looks at as Africa as the continent, the whole continent. Now, looking into the burden of the road traffic injuries in Africa, we see that it has over, and this is with data from 2021, official data from 2021, based on the Global Status Report on 2023. We have that Africa still accounts for 24% of the global road deaths and over 19% per 100,000 population. So it's the region with the highest rate of road traffic deaths, despite hosting less than 4% of the world's vehicle fleet. This doesn't mean that if you have less vehicles, you have more road traffic deaths. I want to stress that out. We would need to analyze further as who is dying and where are they dying? So here is just a regional snapshot. You will see that there are, there's a disproportion between the population and the estimated deaths and the register of vehicles. Again, this doesn't mean that if you have less vehicles, it would mean more deaths. It would just mean that we need to look again into who is dying and where are they dying. So for this, if we look at closer looking to who is dying, we see that there is a high proportion of the deaths is within the most male and active, economically active population. So between 18 and 59 years of age. And this, of course, mean a big problem for the economic growth of the African countries. And when we keep zooming in, we see that half of the fatalities are among the most vulnerable road users. So we see over 50% are among the vulnerable road users. But when we look a bit closer, then we see that it is pedestrians. So this comes along with what Prashanti was sharing just not long ago in the previous presentation, and we see that over 30% of the fatalities are pedestrians, followed by within the vulnerable users, followed by motorized two and three wheelers, and then cyclists, and many others that we actually don't know. So there is a lack of information as well that we need to account for. When we see quickly just the trends, we see that the trends in Africa are still going to the race. It's increasing, just with a slight decrease that it's basically due to the COVID-19 situation. When we look at how countries are going into their targets, we see that only 22 countries reduced fatalities out of the 51 that participated. So, I mean, this is good news, but it's not enough, of course. Another important thing to consider is that since the first Global Road Safety Status Report in 2009, although there are persistent gaps between country-reported and WHO estimate fatalities, with estimated figures being up to 4 times higher than the reported figures, some countries have been reducing this gap. So this is already good news. Actions have been taking place in over 39 countries between multi-sectoral engagement, data sharing, multi-source approach, capacity building, and so forth. However, we still see an important problem regarding having inconsistent definitions in countries, and this is part of the problem in this gaps between reported and the actual data. We see part of the problem being also the data sources being over 30 countries, 33 countries reporting having their data from only a single source, most of them being the police, others being the health departments and so forth, the health data. Only 12 countries having, 2 sources, including police and other, or police and health, and only 5 countries having 3 or more sources. So this is part of the problem that we've been facing. Now, when we look into the road safety pillars, and the best practices on how we're doing, when we look at the first pillar on road safety management, we see that although 49 countries reported having, a road safety lead agency, which is already, of course, a good news. When we start looking into the functions of these agencies or these entities, we see that there is, of course, some gaps that need to be addressed. There is also SSATP. We worked also on analysis of our review of these road safety lead agencies in Africa, and we invite you to have a look at it. We went into how these agencies can improve based on the functions that they have. But anyway, so all we're trying to say is that the road safety management is there, but there's still some gaps that need to fill in. when we look at the promotion of alternative forms of transport, and this is part of also what has been just mentioned, the importance on really promoting active mobility and alternative forms of transport, we see that there is less than a quarter of countries doing so. And walking, only in 14 countries is somehow being promoted. And this is this is linked to the problem that Prashanti was just sharing and stressing in her presentation. And when we look closer into the safer roads and mobility, we see that the needs of all road users is prioritized in the laws of only 4 countries out of the 51 participating countries. And as stated in the Africa Road Safety Action Plan 2011 to 2021 and the one from 2021 to 2030 to eliminate risk along routes frequently traveled by children to schools and for other purposes, we see that there's a lot of countries that still need to put this into their formal legislation and formal road safety assessments as to really consider again the safety for all road users, including children in their journeys to school. So we see also regarding road safety audits, we have less than a third of the countries performing road safety audits. Most countries lack the crucial information to effectively design and plan road infrastructure to meet the safety and mobility of all road users. And this again, it's going to be a bit, it's going to get worse. When I was talking about when we were saying in the early slides that Africa accounts for a very small fleet. When we see that there is an increased motorization, it's increasing rapidly actually, with a total number of vehicles doubling between 2013 and 2021, while the number of 2- and 3-wheelers nearly tripled in the 10 countries with available data. We see that this problem is going to get worse. So there is, of course, that there's a problem also regarding, not having import restrictions, inconsistent reporting on registered vehicles and their type poses also a lot of challenges as the total vehicle estimates were calculated despite these gaps in data. But yeah, just very few countries providing consistent data for all vehicle types. When we look at, despite this, increasing in motorization, we see that vehicle registration laws do not apply to all vehicle types, and monitoring of country vehicle fleet is inconsistent despite the presence of registration systems. Insurance laws don't cover every vehicle type neither. And there is limited regulation on premiums as well. And so overall, in summary, we see that the registration of vehicle in Africa is characterized by weak vehicle registration systems and weak legislation on vehicle safety standards, which lack of measure to protect the most vulnerable road users, including young children. So we should really work with countries to adhere to United Nations road safety conventions by integrating these safety requirements into vehicle safety laws and regulations. And this should be, of course, accompanied by rigorous enforcement measures. When we look at vehicle safety legislation, none of the countries have laws that require safety features for 2- and 3-wheelers, despite, as I was saying, the rapid increase in the number of this category of vehicles. And, having a quick look into the safe road uses, some of the key behavioral risk factors, which are listed here. We're just going to have a very quick look into the legislation of how African countries are doing on this regard. And we see that less than half of the countries have laws that meet the criteria for best practice for at least one risk factor. Motorcycle helmet laws meet best practice only in 8 countries, despite, as I was saying, of the important means of transportation that this means in most of African countries. And on child restraints, only 1 country. And what this mean on child restraint, the best practice mean having a national child restraint law in place that that takes care of children up to 10 years and 135 centimeters in height, must be in a child restraint seat. Laws restrain children under a certain age for sitting in the front seat, and laws that require child restraint meets national or international standard. Looking a bit closer into this child restraint laws, I mean, I'm not going to, we all know that studies have shown evidence of how road traffic fatalities and injuries are significantly reduced when children are properly restrained in vehicles. So the effectiveness is also regarding or considering the child's sitting position, the age, the height, the weight, and the specific laws and the enforcement. And when we look at the countries, how we're doing in Africa, we see that laws mandating the use of child restraints exist in 14 countries with requirements for appropriate age, height, and reference to a specific standard introduced in the laws in 11 countries. And penalties for violations are prescribed only in 8 of these countries. Since the previous global status report in 2018, the number of countries with a child restraint law has increased by 5, but no additional countries have amended their existing laws to meet best practice, including penalties for violations. So again, this is just to reiterate what Prashanti was sharing in her presentation. Now, looking into the driving permit laws, and this is important, right? Because one thing is only it's to regulate also where children are sitting in the vehicle, but it's also important to know who is actually driving these vehicles. And laws that regulate driver licensing are weak, with less than 4 countries requiring basic minimum requirements to obtain driver license. And I'm going to go a bit faster because I know we're running out of time. Emergency care services numbers, we see that there is a lack of emergency care service numbers is limited, and this obviously hinder the activation of the post-crash system. So just conclusion, data-driven solutions really save lives, and stronger regulations are needed to really ensure that we have safer roads, and a comprehensive legislation that has a system-wide approach is key. And for this, of course, leadership and collective action is what is driving the change. So these are just some key takeaways for you to get, and we're going to be sharing all the presentations with you afterwards. So here you have just the QR code for all of you that want to access the report and download it, and you have it also on the chat on the Zoom. Thank you very much.
Thank you very, very much, Maricela, for this presentation on the situation of the continent. When we make reports, it's sometimes, as a big continent, it's subdivided sometimes, but this really gives a complete view, basically, of the continent. And the 2 reports complement each other, which is great, highlighting the fact that road safety is a burden globally, but also, and very much so, in the African region, affecting the most vulnerable, either the pedestrians, but also the children, and sometimes those children are also pedestrians. So this really highlights that the most vulnerable are once again the ones suffering most from this situation. So this is a great way to enter the discussion, where we will talk about, getting from data to action, and all the different steps, whether it's the policy, the engagement of community and youth, the funding. So we'll be discussing this with a great panel of experts that we have today with us. It's a 100% female panel. So very happy to see that in the road safety sector. So I will like to welcome now our esteemed panelists. I'll briefly introduce them, and then we will go into a discussion. Once again, as they discuss, please put in your questions in the Q&A, and we will address these. After the panel discussion, we'll have a session on Q&A. So thank you very much, Chiara, Maria, and Logina. Chiara is a public health expert with extensive experience in international development across the Middle East, Central and Southeast Asia. And she is, since 2023, the lead of the Violence, Injury, and Disability Unit at the WHO Regional Office for Africa, where she coordinates the development of regional policies and strategies for injury prevention, but always keeping in mind promoting health equity for persons with disability. So we will talk about this. Welcome, Chiara. Our next panelist is Maria Segui Gomez. Maria is an international consultant on road safety and injury prevention. And if you don't know, she is the mastermind behind the Global Status Report for Road Safety that WHO published. So since 1991, Maria has focused on understanding the burden of accidents on the population and identifying risk and protective sectors. Her academic career includes teaching and research in the US and in Spain, where her home country, where she has always taken roles in policy and leadership on road safety. And I hope you'll be able to share a few of those insights with us. And last but not least, Logina Abdelmaula is representing the Global Youth Coalition for Road Safety. She's also a distinguished athlete with a unique interdisciplinary approach to social change using both advocacy and arts as tools for awareness and empowerment. And I'd like to mention that one of her most recent achievements, Now I See, is a project aimed at improving mobility for visually impaired citizens. So welcome to you all. This is going to be a very interesting chat with all of you. So let me begin maybe with Maria. As I mentioned, you were behind the Global Status Report for road safety that kickstarted a lot of these other reports. So what do these two reports, in your view, add with respect to the Global Status Report that you coordinated?
Thanks, Binta, and thanks for the invitation of being here. And apologies because it's allergy season, and so you're seeing default Maria. The Global Status Report, in its fifth current version, is not an end in itself. It's a tool. It's a tool for those of us interested in road safety to have either further data for further research or policy recommendations or guidance for actions. And so the more we use the data, the more we analyze the data, the better applications we make, and the more use we extract from an otherwise very laborious and intense effort that involves everyone around the globe. We estimated that nearly 2,000 people participated one way or another into the production of the report. And so I think it's worth acknowledging that and giving value to that work. And so the specific answer to your question is slightly different, because in the case of the SSATP sponsored report, I have to highlight that the Global Status Report is a mandate from member states, and therefore we have to report on all member states, and at most we can disaggregate by WHO regions. And in the case of the continent of Africa, this affects two regions, the so-called African region and 5 countries which are included in the so-called Eastern Mediterranean region. And so for a continent that has the privilege of having an African Union to dictate policy, a continent that has an African Road Safety Charter, and a continent where all the countries could join the African Road Safety Observatory, it made all the sense in the world that we would put a specific report together to synthesize the data that has been collected. You can find references to what's going on in Africa in the Global Status Report. Then each of the two regions developed their own report, and Binta, you led the African Region 1, and Hala led the Eastern Mediterranean Region 1. But those were piecemealed from a continental perspective. And so now you have a report where you can integrate it all. You can still access the country profiles that are available from WHO, and before the link to the resources were given. You can still access the individual country data, so you could still do further analysis, but you also have a continental country profile. And you have a treasure in this report, which is Appendix D, with specific actions and gaps that need to be targeted collectively. And so in a way, we really manage to create a document that is very action oriented and could help policy making at the country and continental level much more immediate. No more analysis and no more analysis paralysis, as we often call it. Let's do this. The answer on the UNICEF report is slightly different. Prasanthi hinted at it. It is 2004, the first ever world report on road safety, that the notion that road injuries were the leading cause or the second leading cause of children and adolescents was stated. And so I think it was long overdue that there would be a specific report that focuses on road safety and children. And I particularly praise Joanne for having tackled that deficiency. And so this report is not African specific. Again, it has to present data from a global perspective because UNICEF is a global agency. But when it has a chance, it presents maps and it presents analysis by UNICEF regions. And you can get a few elements that are very relevant to our talk today. It's been mentioned already several times. It is not only a leading cause of death for the younger population in Africa, which, by the way, is the youngest continent in the world. But it's also the fact that these children are dying either as pedestrians or cyclists or motorcycles passengers or motorcycle drivers. So these are children killed in very particular means of transport, and they are being killed oftentimes by the four-wheel passenger cars or the trucks, the few of them that circulate. And so that sets us in a very specific scenario. Then you have a number of other findings that have been highlighted, but I encourage all the audience, and I congratulate you on the huge turnover that can go into those reports and extract further highlights. So to wrap it up, what it brings is whatever you want it to bring. So if you want, if you don't have enough with all that we have put together for you, please go ahead and get your country profile and get the data and do further analysis, because you can even get the data from previous years from the website we share with you.
Thank you, Maria. And it's true that this report, since the Global Status Report and all the other reports from the different regions, the many Africa reports that have been produced, we see that it's really generating a lot of discussions and thinking around what we can do. So it's really a very important, it's an important tool. And I think, as Prasanthi was saying, it's not just a report, it's actually a tool that brings action into place. So let's move on to the discussion. And I'd like to ask first Chiara, but maybe Lojana, you may want to also complement this when we talk about leaving no child behind and thinking of the most vulnerable group. So children, we know, in underserved communities and those living with disabilities, they often face more risks on the road. Whatever the general population may live will be heightened for children or individuals with a disability. So based on the findings of this report, what strategies or policy shifts do you think are needed from countries, Chiara?
Thank you, Binta, for the question, and very happy to be in this panel. I hope you can hear me okay. Okay, so what about acting? Now we have all this data, right? And I'm glad that it was emphasized in the previous presentations, the fact that today we have more disaggregated data than before. So we are able to describe better the different groups in the population, what are the risk factors and how they affect differently different groups of the population. So it is essential to be able to provide equitable solutions to road safety, because we need to respond to the real needs of our community. So when we know the needs through the data, not only through the data, but let's say data are very important, then we are also able to tailor the interventions and respond to the needs. So let me maybe spend few words in regards of disability, because typically there's always very little data around the needs of this population. And this is a big barrier to be able to tailor interventions and address the needs of persons with disabilities, that I remind everyone, it's a very diverse group of people, and we always tend to forget that. So these are children with disabilities, adults with disability, the older people somehow can be considered part of this group, and then gender considerations and so on and so on. So for persons with disabilities, we need to consider the fact that, and maybe the next speaker will be able to say also more about that, that it's not only a question of safety and surviving while moving, but it's before that is really the capacity to move in the environment where people live, and to be able to be an active part of the society. So this has a double, I would say, value, being able to be inclusive for this vulnerable group of the population. But then let me go back to the wider picture. So let's go back to the idea of equity. If we want to address the needs of the more vulnerable, among the vulnerable, we will actually help the entire society to benefit from that. So I have seen questions in the chat already asking about, okay, so and now what? How can we, for example, apply policies and laws that maybe exist in countries and enact them? So that's a very important question. We know that showing the co-benefits of working on a safer roads can bring the attention of the different decision makers to common goods for the population. So better environment, safer environment, more accessible environment from everyone. And I will give you the first example that comes to my mind is when working on infrastructure and accessible roads, that can serve through the universal design the needs of a variety of people in the community, not only persons with disabilities. Then we do create a more enabling environment for everyone with benefits from everyone. Now, another way to allow changes in the real world, besides policies, is to have not only a top-down approach, but also a bottom-up approach, so engaging with the community. And when I say engaging with the community, I mean being able to listen to the voices of the diverse public that we have in the communities, so that we can really hear about the needs of women, men, children, persons with disabilities, any vulnerable characteristic that you can identify, and then use that not only to empower people, but also to design the solutions that are local. So that is why this is the starting point to design any education, any awareness raising initiative or campaign that whoever is the target needs to take into account the needs of children, the needs of vulnerable persons like persons with disabilities or women. Let's also talk about the gender lens. So just emphasizing the importance of this bottom-up approach. I would like to bring the example of from countries where this bottom-up approach, but also multi-sector approach, is another key word that we need to hear today, working with different sectors, also at the community level. The example of Mozambique, working with schools. There was this project on how to increase the safety of children, they needed to access school along major roads of the country. It became a very successful initiative because teachers were involved, mayors were involved, children themselves and their families. And then this could be rolled out at the national level to benefit all these communities where maybe the risks was higher. So we know about policies, so I will just wrap up by saying that yes, policies, they are there, they need to be built together and to be inclusive and explicitly inclusive with data, with the monitoring tools that allow not only to measure the progress, but also to show accountability of each one of the actors that are involved. So I think I will stop here.
Thank you very much, Chiara. You always speak with a lot of passion about inclusivity and making sure that we have that bottoms-up approach. Logina, I know you've also worked with on inclusivity, but I'd like to take, you can talk about your project briefly, but I'd like to engage you more around, the participation, community engagement. As Chiara said, it has to be multi-sectoral, but it has to be also multi-layer of actors, and youth and the communities play a very, very important role. So a bit of your insights into that.
Thank you so much for your question and for this amazing panel that we are in. Allow me to digress here for a moment, because it's very interesting to note how some of the issue resides in the narrative used on youth. And we're often portrayed as reckless and part of the problem, when in reality, young people, as Ms. Bertonti presented, are the most affected globally, with an estimation of over 180,000 deaths in the global status report. So how could we blame them, or how could the blame be over them? And for those who avoid this fate and grow into adolescence and young adulthood, how could they leave the residues of blame and in order to inspire and create change? And I honestly believe that the answer here might be a very simple, because it's about time that youth are treated as not only a demographic that hinders the system, rather start recognizing them as co-designers of this very safe system that we're all aiming for. And it's also about time that we stop hearing that youth are instigators of problems, and rather be taught the safe system approach and how humans make mistakes and how the responsibility is shared. And it's shared across youth, it's shared across stakeholders and government officials and everyone that aims towards a vision zero, basically. And so when this happens, young people start, when they are recognized as equal partners in the shared responsibility, we automatically transition to being active change makers. This means not just being consulted at the end, but involved from the very beginning in the collection of data, in the policy designing, in the urban planning. And you find that there are so many innovative and creative ways that young leaders can bring into the table. And when we keep on knocking doors, we actively take part in the participation process and the change that we are aiming for. And when we voice our concerns and our solutions, this is also active action in the implementation process. So, for example, there is a segment in the Global Status Report. It's constituted by consultations from the Global Youth Coalition from many countries all over the world, and it represents every issue that each continent faces and the clear process that the youth are expressing in order to tackle them. So such consultations should be exemplary in how youth are involved, and how youth involvement should be standard practice, and at both national and international levels. And if I might also add, such reports, the Global Status Report and the African report presented today, they also should be disseminated to youth across the globe. So when we are well informed of the extent of the struggles that we face, we are able to do active participation very simply. And when our work is backed up with such resources, we'll be able to scale our impact significantly and in every local sphere. So for me, for example, in Egypt, these reports are extremely valuable in order to understand the global reality and be able to refer it and translate it into actual change, into localized actual change, and be able to draw from the solid approaches and the solid data while addressing governmental officials and provide them with solutions for the problems that we personally face. So maybe in short, all what I do want to say is that if the world wants lasting change, we young people can't just be invited to the table. We have to build it, have to help in building it. So yeah.
Thank you very much. Very inspiring words, and we'll make sure to have you at the table, you as representing the young people. And I think this is something that is now acknowledged, and I think there are efforts, to make sure that young voices are heard. You have the dynamism, you have, you have that strength in you that we really have to tap on to make a difference. So we will soon be entering the official Q&A session, but I'd like one last question to all three of you. If you were in charge of a sector, you could be representing the government, you could be representing the civil society. What would you do? What would be that one measure that you would take to shift changes in the African region, but also in any setting that you may choose where you are more comfortable? What would be the one thing? So 1-2 sentences, not more than that. We begin with Logina.
Maybe for me, I would ensure youth involvement in infrastructural designing and law enforcement. And maybe something extra to add is the educational side, because when the community is well informed of the impact that they can bring, they will be able to change the whole landscape.
Thank you. Chiara, next.
So to build on what has just been said, I would add personally the development of curricula, training and capacity building tailored for decision makers, for all the actors that actually can play a role. For parents, they should be also part of parenting, for teachers, parents, but also police, first aid volunteers, or whoever is involved in, for example, post-crash care. So yes, a very comprehensive curricula on road safety.
Thank you. And Maria?
You're asking for the magic wonder. What would I do? And what I would do is I would force the policymakers to think thoroughly on the transportation system they want to develop, because I feel that safety becomes like the Christmas ornaments in a tree that has been wrongly allowed to grow. So we want transport to mean anything to everyone all the time, and we have clash. And what we need to think is what's the transport system that we want to build as a country, from an efficiency standpoint, from an energy standpoint, from all the big ticket items, and then make sure that what we develop with safety at heart, not as an add-on. So if that's the magic wonder that you allow me to, that's the one I go for. And it would be wonderful to see it become a reality.
Yes, I allow it. That systems approach and, thinking holistically. Thank you so much for your valuable insight. And please stay on, leave your cameras. We will be entering the Q&A session. We have some questions that I will be taking and directing to you. So I will begin with the first that comes to me on the chat here about fake and non-standard helmets. They present a serious risk to the huge number of motorcycle users in Africa. The Marrakesh Declaration has focused on this issue, and how can we proceed this point in our future action? I'd like to hand that to you, Maria.
Thank you. Indeed a big problem, but let me talk about two problems: helmets in adults and helmets in children, because everything in that chat question is about helmets in adults. And for better or for worse, we know how to make a safe helmet for an adult. And we have even developed a helmet that is lighter in weight and breathable for hotter climates. But that's called standardization. And the one thing that is missing in the continent is the adoption of standards, in particular the UNESCO standards for helmet regulation. And what I have learned in the past couple of years is that at least a couple of African countries are starting their own testing facilities so that they can actually develop a market, a continental market, so you are not depending from others deciding on the standards on the quality. You can create that knowledge yourselves. Very quickly, helmets for children. It seems to be like the hot topic of the day, because we realize we have a problem with children being transported in motorbikes. But let's be careful and not rush into conclusions, because I will take Mustafa's words at the beginning. On that particular topic, we need research. We need research to demonstrate what type of a helmet works on children of different ages and different head sizes and different proportions. So let's not rush into extrapolation that a helmet works in adults doesn't necessarily equal that it will work in a child. So let's push for helmets in adults as we know. Let's enforce those legislation. Let's assume the regulation, but let's do research. And this is something I would love for the African research community to jump on. Produce research, ally with researchers from other countries and other continents with an experience, and do the basic work that is required to determine whether that is an effective alternative. Sorry for the passion on this, but I'm just very mindful of the mistakes that we could be making if we advise for the wrong instrument.
Thank you for that clarification. And I think we can also share with the the different participants some tools that have been developed by WHO on the helmets, on motorcycle safety, and all of those guidelines that we have. We have many guidelines. There's still more that may be needed, but we do have a lot of recommendations. I have here another question on how do we, in a country with very high poverty, ensure that the law is enforced, especially regarding the use of child restraints and the seating of children in school buses, scholar transport. If you can afford a vehicle, you can afford a child restraint. That's the assumption. How do we bring this together complemented with enforcement? Shouldn't stronger responsibility be placed on parents? So this is a loaded question. Anyone wants to take it? How do we ensure enforcement in a context of low resources? Chiara?
Yes, there are, the principle here is always to work through the whole system. So we cannot have a change unless we work with the whole system. That means that we need to have decision makers and politicians accountable for that, have the police and the security, let's say, actors involved in this. We need to have more awareness and change attitudes and behaviors of families. So we can also use a lot of scientific approaches to work on behavior change. But again, we cannot only focus on the change of individuals. We need to work in the system, on the accountability of the system, if we want to really have a change at all levels. It can take time, but actually, when there is a very decisive and would say coherent approach to it, like all of a society or all of a system approach, the changes can also be quick. And we have examples from countries in Africa where this has been effective.
Thank you. Thank you. If you look in the chat, the Q&A, there all have already been responses to some of the questions. Some of the questions are a bit of the same. We cannot take them all. So you consult as well to see the responses that have been provided by the different panelists and speakers. Sorry, I have another question here. What role will non-governmental actors play in implementing the SAFE system? Logina, can you take that one?
Yes, absolutely. So, well, it's the small changes that do the work, so it doesn't have to be all on the government officials. We, as parts of the community, when we're able to do interventions, small interventions around our society, it scales into a bigger impact. So in order to be able to have an actual change in the whole society, every person can do this change on their own. And it's interesting because by involving even younger people and everyone in such implementation process and consulting them, they know the city like the back of their hand. They know the danger zones in their city, so they're able to speak more about all the troubles that they face in their communities, and this way they're able to contextualize it. And by contextualizing this, it's always going to lead to an effective change and an effective implementation process from all segments of the society.
Thank you so much, Logina, for this perspective. Really very interesting questions in the chat. A lot around motorcycle safety. We see that this is like a growing threat to the youth. Most drivers of motorized two-wheelers are young men. We have also questions around financing. And this is a question from Sydney. Will funding continue to be a stumbling block for projects that seek to deal with fatal incidents and fatalities? Do we even consider the safety of youth and children in our global planning? I think this is a really a cry to investing where it's needed and not seen as an expense. This is a crucial element, especially in the African region, where the gaps in funding really are reoccurring. Do you have any insights, Maria? And would you like to maybe contrast with other regions that you are familiar with? And perhaps we can also bring in Maricela on any insights around the big issue around funding, and how to make it sustainable. Over to you, Maria.
Well, several things. If we are really seriously rethinking transportation, then the funding is there. There are millions of dollars, to use a coin, spent every day on transportation matters. And the problem is that we are using them either forgetting to incorporate safety into them or developing the wrong transportation system. And so whenever I hear the complaint about not there being money, I say that's not true. There is a lot of money that is intentionally being used anti-safety in anti-safety devices. I think that it's important to remove road safety from the charitable action. It's important to bring it at the core of our decision making, whether it is in regard of the transport development, and this is where entities like SSATP or the World Bank or the other big funders have a lot to say, and I'll let Maricela or Mustafa later comment more on that. But there's also a lot to say about corporates. We cannot forget that most of our mobility stems from economic transactions. I move to go to work. A good is transported because a customer wants it here or there. I bring my bananas to the market. And so we should make sure that the commercial transactions incorporate into them the cost of transportation and the cost of ill transportation. And so the second source of money I would tap on is on the companies restructuring the how often and how badly they move their goods and their people, and they integrating the safe practices into their mobility strategies. And to that effect, I'm happy to report on at least 2 initiatives that are trying to address the parallel of the monoxide footprint, the environmental safety. Instead of an environmental footprint, why don't we develop or disseminate the concept of a safety footprint? It would be lovely if the next piece of furniture that you buy from the Swedish manufacturer we all go to says, and no one was killed in the production and transportation of all the materials that were used. And I bring this particular example because this particular company is actually piloting this concept, and so it's a very good example. And so if we really tap on the money for development of the transportation system, and we realign the economics of transportation of goods and peoples, we will have taken a huge chunk of the problem, and then this is not anymore a matter of charity, but a matter of structure.
Thank you so much. It's such a new way of thinking in this sector. We have to really change our mindset. But I see, Maricela, did you want to come in just to add anything to this aspect of funding, which is really dear to many people? It has always been a stumbling block.
Yeah, no, I think Maria really kind of summarized it very well, but I just want to add that a very important way of doing this as well is when countries really have legislations, right? Like laws requiring for formal, as we were saying, formal road safety audits or formal road safety assessments, when they actually do focus their investments based on not random decisions, but actually based on safety matters. So when this kind of laws and standards are in place, then it doesn't matter who comes into financing that infrastructure, right? There should be this minimum requirements that need to be put in place. This needs to be minimum standards that need to be accounted or considered. And this goes as well, as we were saying, to have to account and to consider all road use, the safety of all road users, and not only on motorized vehicles. So as soon as countries really have this minimum requirements / standards, then it would be easier also to trickle down this financing that, as Maria says, it's there. It's just a matter of how we actually are using it. Thanks.
Thank you very, very much. We are coming to an end of this session, and thank you for your so valuable insights. The discussion was rich, and I hope very interesting for those who are participating today, and with key messages. And I'm sure, like, you can reach out to all of us. You'll have our contact details to further the discussions as well, because we're here to support countries. That's what we do. Thank you so much, panelists. And now I will invite Joanne Vincentin, Dr. Joanne Vincentin, the Global Lead for Child and Adolescent Unintentional Injury Prevention from UNICEF, to close the meeting and give us the closing remarks and next steps to this webinar. And thank you so much for all that you've done for this report. On behalf of WHO, on the different partners, we really wanted to thank you for this really great resource that you've left with us. Thank you so much. And over to you.
Great. Thank you all very much. And what an exciting session. It's just been fantastic hearing and listening to everyone. And it's very interesting. We were trying to squeeze this webinar into the Global Road Safety Week, and it's been such an exciting month of May. And so I'm thrilled that we were still able to fit it into May. And also now that this webinar comes right at the close of the International Transport Forum. And what a rich discussion that we've had. I just want to emphasize again, as key takeaways from this session, is that it's been said by every speaker and every panelist so far, is that road injury is a huge burden, not only for children and adolescents, but for all ages. And it's data. Data is not just paramount, but it's powerful. We need to use that data to be able to accomplish the things that we really need to have happen and what works to reduce the devastation that road traffic injuries are causing. We need to take that data and use policy actions that not only will reduce deaths and increase safety, but also will advance protection for children, but for all in our communities. So this is something that we can actually enforce. And another fourth major takeaway that came through over and over again from all of you was the fact that road safety is part of an overall wider system, and that we need a systems approach to be able to tackle this effectively. And that means that we need to integrate and embed all of our road safety activities and what we know works, and that we have that across diverse systems, and that we are actually scaling, and that when we scale, then we also sustain, which goes back to what we concluded on our financial funding discussion that we just had. So all of those things are important, and that we do that in a multi-sectoral approach with diverse sectors, including youth and children, governments, schools, education, diverse government sectors. This is not only a road issue. This is education, this is health, this is environment, as was mentioned several times. And that when we do this work, we want to ensure that it's not only safety we're talking about the co-benefits. And for those I'm sure are aware, we are approaching a new decade. In 2026, we will launch safe and sustainable mobility. We're looking at the mobility transport, new decade approaching. And so these are ways that we can integrate and have next steps moving forward on what we're talking about here today on not just safe road systems, but talking about safe and sustainable mobility that can move us forward for action moving again. So my big thanks again to all of our presenter speakers, our panel speakers, our excellent moderator, and to all of you as participants who have taken your time today to engage and be part of this presentation and discussion and action moving forward. It's all of us together that are going to make this different and be able to advance what needs to happen in road safety. So be active. Be an advocate, continue to do all the excellent work you're doing, and share this information. Share the materials and use the materials that have been provided in the chat and that you have access to, and share it beyond your own teams, but within your wider circle and network so that we can get this message out. I'd like to thank you all on behalf of UNICEF and to all the partners in this webinar that have helped to host this event through SSATP, WHO, the George Institute for Global Health, and on behalf of UNICEF, I say a very big thank you. I pass back to Binta if there's any administrative or logistics that we need to use to close. Thank you all so very much.
Thank you very much, Joanne, for these inspiring words, taking us to the next step. There's so much to look forward to. I thank everyone, the interpreters, the participants, and we will be sharing the recordings. We'll be sharing the presentations with you, and our contacts are also in the chat, and you'll also get them as we share all the different materials. Thank you so much. Bonsoir et bonne journée. Au revoir.